solution for high-flexion PS-type prosthesis in artificial joint replacement surgery for knee varus deformity. Patient's general condition name: Myth, Liu gender, female age, 58 years old. Chief complaint: pain and deformity in the right knee for over 5 years, aggravated with limited mobility for 1 year. Present illness: the patient started experiencing pain in the right knee joint without obvious cause 5 years ago, leading to difficulty in movement. The pain worsens after excessive walking and climbing stairs, but improves with rest. No treatment was received during this period, and the symptoms recurred several times. A year ago, the patient felt increased pain in the right knee, but did not receive special treatment. Seeking further surgical treatment, the patient visited our hospital, and the orthopedic outpatient department diagnosed it as right knee osteoarthritis and admitted the patient to the orthopedic ward. The patient's condition was clear-minded, with normal mental state and adequate diet, sleep, and normal bowel and bladder functions. Past medical history: generally healthy, with no history of viral hepatitis, pulmonary tuberculosis, typhoid fever, or malaria. No history of diabetes, hypertension, or hyperlipidemia. No history of heart disease, cerebrovascular disease, mental illness, endemic disease, occupational disease, trauma, blood transfusion, poisoning, drug or food allergies. Vaccination history is unknown. Personal history: born and raised locally, with no history of exposure to epidemic areas or any special habits such as smoking, alcohol, or other substances. No history of exposure to radiation, chemicals, or dust, and no family history of hereditary diseases. Preliminary diagnosis: right knee osteoarthritis, specialist examination. The physiological curvature of the spine exists, with normal mobility and no tenderness or percussion pain in the spinous processes. The right knee joint has slight swelling, no skin damage, normal skin temperature and color. There is a 10 inward deformity of the right knee joint, with positive tenderness and percussion pain, negative patella float test, negative MCL, medial collateral ligament stress test. Normal sensation, muscle strength, and muscle tone in both lower limbs, and palpable dorsalis pedis pulses with good peripheral blood circulation. Preoperative plan: considering the patient's physical condition, careful assessment of surgical risk, preoperative discussion by the surgical team, and detailed communication with the patient and family about the surgical plan and prognosis. The patient's condition was diagnosed as simple osteoarthritis of the right knee joint, and a type 2 knee prosthesis was chosen for replacement. The patient completed relevant laboratory tests and underwent total knee replacement surgery for right knee osteoarthritis. The surgical procedure went smoothly, and post-operative measures were taken to prevent wound infection, thrombosis, and other targeted treatments.